Um, Hello everyone present here. Um, Welcome everyone to our session on careers in psychology. It is a pleasure to have all of you here. This is a session organized by the Psych Life, which is a mental health initiative working towards providing affordable therapy, trainings, and raising mental health awareness, and also building India's first mental health store. The Psych Life is founded by Miss Kirti Garg, who is a psychologist by profession, an assistant professor, and a mental health advocate. And hi, I am Tanvi Chopra, a team member here at the Psych Life. It is our pleasure to welcome the facilitator for today's session, Ms. Palak Agarwal. Ms. Palak Agarwal is an RCI licensed clinical psychologist and also qualified UGC NET. She has completed her MPhil in clinical psychology from National Forensic Sciences University, and she has worked in various esteemed organizations and hospitals such as AIMS, Sir Gangaram Hospital, Wim Hans, Fortis Escorts Heart Institute, and she has also made significant contributions in the field of neuropsychology, child psychology, community and rehabilitation psychology. Welcome, ma'am. It is a pleasure to have you here.
Thank
So
you.
we'll be beginning with the questions, and all of you also, you please feel free to ask your questions in the comment section below, and we'll definitely take them up. So we'll begin with the first question. What are the essential competencies which are required to become a good psychologist, be it be organizational or clinical or counseling?
Fine. Thank you for the introduction. Firstly, I am glad to be a part of this event and initiative because I think it's giving us a platform to connect with numerous students and psychology aspirants. So, firstly, congratulations. I'll begin by that. And then, coming to your question, that requires me to answer competencies. So, firstly, I feel that the first and foremost competency is being open to learn, being open to the newness, because psychology itself is one field where, even though I'll speak in terms of clinical firstly, because clinical is my expertise. So the even the common mental health disorders have their different manifestations for different people. So it's very essential that we become open to different modalities, different experiences, and to be able to incorporate opinions of others. If we are holding certain biases, certain attitude, it becomes a challenging factor that interferes with your own skills and with the rapport, be it in any field, be it in counseling, be it in OB, be it in clinical, because essentially for a psychologist, it is very important to have a rapport. Everything initially is based upon rapport. If you don't share a good rapport, it can impact and create a negative image of your own self. So rapport is one thing. Then coming to another set, which is professionalism. Now, by professionalism, what I mean is that please complete all your qualifications. You know, nowadays during COVID and all, we've seen that many people who were not even qualified considered themselves to be psychotherapists, psychologists, clinical psychologists, but it is very essential that somebody who is claiming to be one, they need to have certain qualifications, be it in OB, be it in their clinical field, be it in counseling. And you must tell your clients or your patients or your consultants, anybody, about your qualifications and your experience. Tell them it's their right. So, secondly, it's that. And coming to another one, which I feel that every day, if you're just updating yourself, you're constantly in touch with the latest technology, latest researches, latest upcoming mental health, probably propagandas and facilitations, anything like that. You need to be updated. You need to be updated in your theoretical background as well as in your practical field. So it's very essential that we all must follow the latest work. If we're using obsolete methods, I'm sorry, it's going to be very, very outdated, and the impact wouldn't be as much as effective as we've seen in other cases. And the lastly, I feel that confidentiality in any case, following the APA principles, confidentiality, consent, and right to withdrawal. These are the three major principles that APA talks about. You need to have that freedom for your client where they can withdraw from therapy or counseling and all anytime that they feel it's uncomfortable. And if you're not having certain expertise while dealing with a case, please do not hold on to your client. Refer. That is very important. So for now, I'll rest this question to this note that it's very essential that we refer and follow the APA principles. That's the first and foremost basic things. Thank you.
That's quite an insight to the entire question. I think you've answered it really well, and I also really resonate with the answer that you give, that we have to upskill ourselves and be updated with whatever's going on, because considering the problems that we have in upcoming days, and considering the competition also that we have, I think it's very important to upskill ourselves and be updated with whatever's going on around us. So
Yeah.
that's great. So the next question is, what is the? I think a lot of students who are particularly in their bachelors also, I think they will resonate with this question. So what is the starting salary or the average salary of a clinical and counseling in the OB psychologist?
Okay. So firstly, I'll come to the qualifications and then I can further answer this question better, right? So for a counseling psychologist, they can start with their masters, and it is preferable not just after masters. They need to go that child and counseling, proper RCI recognized counseling courses, or NIPSID and all these places. They've been running their proper counseling courses. It's recommended to undergo proper training and then probably a diploma or so, and then start your practice. If you do that, it gives you an edge over somebody who's just masters, because they believe that it is somebody who's coming with a proper training phase. So certainly for that person, the starting package becomes 30,000 or something like that. For person who is just starting with right after masters, most of the places like clinics and all prefer between 20 to 25,000. This is, I'm particularly focusing on northern area because I'm from northern and western part, because these are the areas that I've been working and familiarized with. And southern parts, because I've not been in touch with many of the other professionals from the southern part, so I need to confirm and reconfirm. But this is basically, I'm covering the northern region as well as the western part. So this was the case. And for clinical psychologists, now somebody who's wanting to become a clinical psychologist, they need to have their bachelor's in psychology, master's in psychology, and MPhil in clinical psychology. That is the licensing program, or PDCP. That is a diploma course, 1 year proper diploma course under RCI. And once they have that, so for somebody who's MPhil, it gives him a license to practice as a clinical psychologist as well as do research, teach, and all. Now, somebody with a diploma degree can become an associate clinical psychologist. So they can conduct assessments, practice therapy, and all. But teaching is one such area uh, where they probably need to do a lot more upgradation, do a lot more other courses to start teaching and get into research field. So these were the three aspects, and then coming to OB. So OB requires your masters in organizational psychology, industrial psychology, fields like that, or you can have that field that you're going through the human resource management area, basically via your management courses and all. So now the thing is that one struggle that often, this is a practical thing that I'm sharing it with you, that people with masters in OB, they have often complained that people with MBA degrees and all are also competing with them. And definitely for somebody who is MBA, it gives them an edge to go into HR and all. So that is one challenge. But nevertheless, for corporates and all, the starting minimalistic is 35, 30 to 35 minimum. And then how, because corporates offer a lot of increments and all, so it keeps increasing. 45 to 50 average they're able to reach. Considering that this is the scenario of the metropolitan cities that I'm talking about, Delhi, Mumbai, Bangalore, majorly covering these cities, right? Now, for the two tier cities, now the case might differ because metropolitan cities are rising nowadays in terms of mental health. But when we're talking about secondary cities, it's yet to, um, you know, yet to become more popular. The field also needs more advancement in the secondary cities. So maybe in years to come, we can see a larger progress considering the post-COVID era has seen a paradigm shift in terms of mental health. So probably way to go. So this is the average salary along with the qualification. It combines all the two questions together.
Sure.
Thank you.
Thank you so much, ma'am. Also, would you suggest someone who is doing organizational psychology? So, would you suggest them to probably pursue their MBA or some other skill, that they can pursue, or some other course that they can do in order to give them an edge in the industrial field?
Definitely, they can do that. It's no harm. Additional qualification is always beneficiary. And considering now, just after your bachelor's and master's, it becomes quite difficult to gain a good job. So any one specialization over the other gives you an edge. If you're having that MBA degree, probably or some additional course, it gives you certain recognition, so they can go for that. Nevertheless, that the competition in OB is also very higher, and nowadays demand for clinical psychologists in corporate is also increasing. So this is also one area, one prospective area which is opening for people who are into clinical, so they can go via clinical or counseling field also. It's not that the doors of corporates have been shut.
And are there any other courses or any sort of qualification also that they can pursue other than MBA?
As of now, management courses, because it's coming a lot from the commerce background, so I need to maybe read about it and then I can answer it better. For now, I was just aware of MBA and probably HR courses in HR and all these fields, but we can definitely read upon this and reflect upon this. So,
Definitely, ma'am. Thank you. So
thank
the
you.
next question is, what are the career paths that are available for clinical counseling and OB psychologists? Like, which are the areas where they can work?
Okay, I'll start with the clinical since it's my domain and my first my area of expertise. So, for a clinical psychologist, they have three, well, probably four major areas. Okay, firstly, coming to the hospitals or clinics, private clinics. Nowadays, demand in private clinics, private setups, and hospitals have been increasing for clinical psychologists. So there has been a great scope post COVID era. Okay, and then we come to another domain which is private practice. People with MPhil or with PDCP, they can get into private practice. They can open their startup or something like that, and then they can start their own mental health venture. Then there are government projects also into research. Many government hospitals, many government institutions have been offering research projects or contractual basis projects where a clinical psychologist can work on probably a 1 year period, 6 months period, and it's a decently paying job. It's a well paid job, right? And then maybe the projects keep coming. So it's not that after 1 year either the job is there or not. Every year, most of the recognized institutes like AIMS and all, their projects keep coming. So you can go from one to the other. And teaching is also one field. Couple of my friends, after their MPhil, they've been getting into institutions, schools, and colleges. Either they're practicing over there and simultaneously teaching children also about psychology in schools as well as in colleges and universities. So this was all about clinical. Coming to counseling. Counseling again, it's highly prevalent in clinics. Clinics are demanding counseling psychologists as well as big hospitals too. So a lot of places have been working like, I'll tell you, a combination of clinical and counseling psychologists working in a cohesive manner. like a team, psychiatrist, counseling psychologist, and clinical psychologist. So which is great. Then there's rehab, counseling psychologist or a clinical psychologist then can opt for rehabilitation centers, and counseling psychologists are also being demanded in MNCs, mental health startups, and many online portals where people with people with masters in counseling psychology have been hired, a lot of them. So these were the few organizations. And then coming to OB, I feel that currently, because there was a period pre-COVID that a lot of demand was there for OB, but lately what we've seen is that now people into clinical and counseling are also getting their scope and edge in the field of OB. So, OB is now more focusing on marketing, research, psychometric assessments. So, organizations that are catering to that, definitely people with the organizational psychology degree, masters in psychology, organizational psychology can get into that. And along with people who have done their masters in counseling psychology or some other areas. So, a lot of my friends, what they've done is, along with masters in OB, they've also had a diploma certifications of counseling psychology. So that gives them an edge, an additional qualification. It's always beneficiary, especially in our field, which is so diverse and yet so converging. So that was it. Thank you so much. And any more doubts in this entire narrative?
I think you've answered it really well. We have a question by one of the viewers. So she says that what is the right time to look for internships?
Right time to look for internship, right? I will suggest, please start with your bachelor's, and don't wait that I'm in my first year, I will not get it anywhere. I'm in my second year, I'll not get it anywhere. There are many, considering mental health awareness has been increasing. There are many clinics which are offering internship programs. Many hospitals are also now open. So it's preferable. Bachelor's in psychology is one such area, which gives you a very open platform to explore in which field do you want to get into. So do a lot of internships. If you're not clear whether you want to get into OB or whether you want to get into clinical, work in different setups. When I remember when I was in college back in DU, so at that point in time, we never even got to know that there are certain internships and all in our first years. So as a student, we have to be slightly proactive. That is very essential. In colleges, it might not appear because we are more or less we're focusing on the theoretical aspects. So go for NGOs, go for these workshops and all. Over there, you get an idea. You connect with different people. You get to meet people of different fields, of different colleges, and then you interact with them. They will also tell you a lot of things. Ask your professors, and ask people on LinkedIn and all. These are also the platform now which are becoming more and more popular. So online medium is also one great platform now. I feel back in those days, I think 2015 when I was doing my bachelor, so it wasn't that prevalent. It was, but not to that extent compared to it is now. So people nowadays are getting a lot of psychology based workshops and internships via online platforms. Many organizations are doing that. So I'll recommend start with your bachelor's and don't wait that I'll do it in third year, second year. You time passes by and we don't realize. So it's my suggestion, my personal suggestion, that you can start with your first year summer break.
Okay. So with that, could you also suggest some probably some institutes or some organizations or hospitals that offer internships for bachelor students or even masters for that matter?
Okay. Are you particularly looking for Delhi NCR?
Yeah, yeah.
Okay. So a lot of NGOs are there, many NGOs, Mental Health Foundation India. Then there are hospitals like Fortis, Lumans, and AIMS, and then there are many clinics also. One was in the this area that. near Rajori Garden and all, many clinics, Santulan, all these other private clinics which are offering internships, I believe. So people can go into that. And then there are online portals also. I was lately reading a post by a portal called Psychosiksha. So they are also offering a lot of internship programs. Then there's Karma Center for Wellbeing, which is also again offering a detailed training and internship program, which is combining of thorough training, I think, exposure to a lot of clinical disorders and pictures, and interns are being trained by professionals, so which is great. Very wide exposure, I believe. So these are the common platforms. Um, Hello, am I audible, Tanvi? Uh, Tanvi, you're not audible to me. I don't know. There's a technical glitch, I believe. Tanvi hasn't been audible. Hello. Uh, yes, yes, you're audible now. Please.
Am I audible now?
Yes, 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 you're audible.
Hi, am I audible?
Yes, yes, you're audible.
Okay, so I was saying thank you. I think that was quite an insight. You've offered us so much, a lot of internships and a lot of opportunities that you've mentioned.
Yes,
So the next question is that what are sorry. So what's the best part according to you about being a psychologist?
yes. Best part about being a clinical psychologist, I feel that, as I said, every day is a new learning, and every single day you get to explore something about yourself as well as the world outside. And the fact that it's a field which is ever evolving, and this field interacts with all the other fields. And people often complain that my theoretical part is not in alignment with my practical aspects. This is one such field where when you learn about theoretical aspects, you can actually see and observe and reflect upon it, because many theoretical principles are based on clinical observations. So, beginning from all of your conditioning principles to your fear phobias to all your personality disorders, everything has certain elements of all the theories that you've studied, along with what you see and observe, and also giving a lot of importance to the cultural context. How we merge this theory and amalgamate it with our cultural context is a creativity. So it's a beautiful field of art as well as science coming together and interacting with each other.
Yeah, I think that's quite true. I mean, I really agree with you because so even while I'm in my bachelor's, I feel that even while I'm studying psychology, I feel like that I can understand everything, I can relate it very well, and it tells a lot about myself also. So I really agree with you. So we have another question which says that which colleges, according to you, are good in order to pursue masters in clinical psychology in India?
Clinical psychology, particularly. Okay. So I feel firstly TIS it, and Manipal. Manipal and TIS, because I've had couple of my friends who've been telling me that TIS and Manipal are offering great exposure to the students, and a lot of practical work. So during masters, people who've been you know people who have been in Manipal, they get an exposure of assessments and diagnostics, all these kind of things. And then I feel that Amity Noida, because I was doing my masters in clinical psychology from Amity Noida, so a lot of papers that Amity has, it's about theories, it's about neuro, and rehabilitation, community psychology, forensic psychology. So it's it gives you a glimpse of subfields of clinical psychology actually, and then you can pick up the bits and pieces, and then you can learn about subfields in your masters, which you can learn in greater detail in MPhil. So it's very important for anybody who's doing masters in clinical psychology. I'm sure that when they're aspiring to do so, they're seeking either research or kind of a practice, and then wanting to pursue higher education. So they must look out for an institute that gives them enough chances for internships, practical exposure, as well as the subfields in clinical psychology, like exposure to uh, therapy based papers, exposure to clinical disorder papers, exposure to the neuro field. Neuro is a very important component of clinical, although it's a separate discipline, but it has a very strong interactive um, course with clinical psychology, as we follow the biopsychosocial model in our country, where we emphasize a lot on brain and behavior also. So, and then rehabilitation is one such component. So, research and statistics also gives you an edge. So, please be aware with the syllabus, with the curriculum, the kind of practical exposure that one has. Connect with the alumni of different institutes so that you get a hang of it. And then we have entrances. So don't worry, even if the you're not able to make it in the topmost institutes, it doesn't matter. If you're wanting to pursue higher education, then MPhil itself will give you an edge. It will give you an idea of how things work, where you learn to practice as well as combine it with your theoretical principles. So I feel that if somebody is doing masters in clinical psychology, these are good institutes. Christ, and then another is DU, Jamia. Ambedkar is one such institute which specializes in psychoanalytic studies. So if somebody is inclined towards that, particularly wanting to study disorders from a very psychoanalytic perspective, they can get into that. But if not, because I know how challenging the field is and entrances are quite difficult, there are many aspirants and then seats are less. So if you're not able to make it, do not worry about it. Maybe you can try for another institute and then pursue your higher education into MPhil, because MPhil is something that is very important if you're wanting to practice. So thank you.
Thank you, ma'am. So we'll take up the last question, which is
Yes.
after masters in psychology, what kind of patients can we deal with as a professional and where to look for jobs?
After masters,
Yes, ma'am.
After masters, you cannot see clinical patients. That's unethical because MPhil is necessary. MPhil is a licensing program. Somebody who is just having their masters can see people with life-related stressors, or basically somebody dealing with adjustment issues and all. But clinical disorders, they're not permitted to see. If they're noticing that there's an underlying depression, anxiety, personality issue, they need to refer it. Otherwise, it's unethical kind of a practice. So, no disorder is permitted as of to the best of my knowledge. It's basically major life-related issues. Probably person having difficulty with the stressors in the environment, daily hassle, struggles, and all these things. These are the areas that you can work upon. But clinical disorders will be dealt by somebody who is a licensed practitioner, right? So that is important.
All right. Also, so since a clinical psychologist particularly looks after people who have like mental disorders and all, so are they also trained to look after the lesser people with lesser problems, if I can frame it that way? You know, somebody who's dealing with stress, or would clinical psychology just limit them to dealing with people with disorders?
Very good question. Thank you. You've been putting it. Thank you for putting it forward. It's very important and it needs to be answered. For somebody who is having clinical disorder expertise in dealing with clinical disorders, it is very certain to say that they may, once they have attained that level of expertise, they can also work with people having lesser issues, right? And since diagnosis and treatment plan is uh, emphasized a lot during your PDCP course and MPhil course, so you can identify. Till our masters, we're not taught to identify or to how to take case history and then formulate it and then give a diagnosis and all. That is not the case. So until and unless you cannot formulate, put forth the diagnosis or identify the underlying issues, until unless you don't learn to rule out. That's not taught during your master. That's taught during your MPhil. How do you rule out whether there's an underlying issue or not? So if for somebody who's just done their masters, how will they rule out that there's no comorbid psychopathology? What kind of questions to ask, right? So that is taught in your MPhil thoroughly. You have a set of questions; those are on your tips to learn to, which enables you to rule out. And of course, then your clinical experience, your observational skills, and all. In a span of 2 years or more, there's always way to go. Complete learning experience. The more cases you see, the better you become as a clinician, right? And how open are you to learn new things? That also matters. So I feel that for somebody who's done MPhil can identify whether it's falling towards the lesser spectrum of certain issues or it's going towards the higher end of it. So definitely, people with MPhil can work in both counseling aspect as well as a proper therapy aspect.
All right, thank you, ma'am. I think that was
Thank
quite a
you.
detailed answer for, I think you've answered all the questions in great detail. And
Thank
I
you.
really hope that all the viewers also have got their answers.
Thank you.
I will conclude this session, and I would like to thank you on behalf of Team PsychLife for giving out your time and answering all the doubts that our viewers had. And I think it was very, very insightful for each one of us to listen to you. Thank you for taking our time for us. So,
Thank you so much. Really enjoyed interacting with you, and similarly, it was insightful for me. Also, great questions, and maybe it can benefit the viewers. Thank you for staying with us, all the viewers, as well as the platform Psych Life. So, thank you, and thank you, Tanvi, for all your inputs.
thank you.
Thank you. Thank you. Bye bye.
Bye.